All right, guys, the next procedure we're going to watch is Trach Care.
I'm Kat. I'm from respiratory, and I'm just gonna demonstrate proper trach care. I just want to start with saying all the things you'll need: saline, inner cannula, usually 2 packs of gauze, and trach tie should all be in the residents' bedside tables. I personally always start with checking their oxygen if you have a pulse ox, just to make sure they're good, because sometimes you have to take their oxygen away in order to do proper trach care. So let's get started. I typically start with removing the dirty gauze from the patient, throwing it away. Actually, first I suction them if they need it before removing everything, otherwise you might get secretions on you. So suction first if needed, remove dirty gauze, throw away. Then I take the inner cannula out, throw away the dirty one, however you like to do it. And when you're gonna open up your new inner cannula, make sure it's the correct one. It will say on here, and it should be the correct one in your bedside table. The easiest way to do this is to act like you're putting it in and turning at the same time to get the right angle. So you're gonna start here and turn to get a proper angle. Okay, so once that's done, you're gonna open these first, actually, to make it easier for you. Always date your trach ties on the whites so we know when they need to be changed. If they need to be bigger, you can make them bigger or smaller. What I do is I get them ready. I would get this part ready. Have a clean piece of gauze. You're gonna crack one of these saline bullets open, squirt it. Gonna get around the stoma area if you need. Usually I fold this back. Always try to have one hand here on the airway at all times to keep the trach from falling away. You're gonna cleanse the neck and the stoma area depending on how dirty. And then once you do this, I personally like to keep one hand here, open a trach tie, slide it in if possible. This way you can keep one hand near. Okay, and then what I do is I unvelcro this side, because some people have a bigger neck and it's hard to lift their neck or get around them. So I try to Velcro to the other side. I pull it through to prevent from having to remove your hand from the trach. Discard the dirty one. Clean again if you need to, but should already be cleaned. Typically this stays. Okay. And then we're gonna pull through this side. Can get it. Okay. So as you can see, he needs he's got a bigger neck, so you can loosen this side a little more if you need to, and through here if needed. Make sure it's not loose around the neck area. Pull through. You like to have like one maybe finger on each side. You don't want to be able to do too many fingers, because otherwise it's too loose and the trach can get dislodged. So once that's complete, you want to get your new pack of split gauze. What I like to do is place it here. I like to keep my balloon through here to make it easier. I slide this way. I do one at a time just to make it easier, keep it more clean. And then I slide over, come to the other side if I need to, slide the other underneath. Try to make sure it gets under the flange. Make sure it looks good. Again, check for looseness. Ask the patient if they need anything, if it feels okay, and then discard everything that's dirty, and that's it.